everyone. Let's talk about pharmacy laws and ethics and code of ethics and ethical principles. Let's talk about the introduction. Pharmacy practice is always a highly regulated and controlled profession. This is because the pharmacy practice deals with the handling of the drugs, and it is regulated by various codes of ethics, various regulations, and numerous acts. Both the federal and the provincial government, as well as the specific empowered provincial colleges of pharmacies, are involved in the college control of the pharmacy practice in Canada. The target for all these control is to ensure the safety of individuals and to promote a safe practicing environment for pharmacists, pharmacy technicians, and pharmacy assistants. First is code of ethics. What is it? It is a responsibility that comes with being an essential health resource is significant. As a professional, the pharmacy technicians and assistants, we are challenged and expected to abide by the higher standards of conduct. A pharmacist, technician, or assistant, they use his or her knowledge and skills to serve the patient, contribute to society, and they act as stewards of their profession. So code of ethics is neither a law, an act, nor a regulation. So what it is? It is a set of standards for professional behavior. They stipulate how professionals, pharmacists, technicians, and assistants are supposed to approach the problems, drawing their guidance from ethical principles. Code of ethics is a set of behavioral guidelines for a group of profession. Although the code of ethics is not technically a law, its violation can be a valid ground for severe disciplinary actions up to or including termination of an employee's appointment. The Canada College of Pharmacists Code of Ethics is divided into 3 segments: responsibility to patients, responsibility to society, and responsibility to the profession. First is responsibility to the patients. We hold the well-being of each patient to be my primary consideration. We respect each patient's autonomy and dignity. We maintain a professional relationship with each patient. We respect each patient's right to confidentiality, and we respect each patient's right to healthcare. Then is the responsibility to the society, which includes the advance public health and prevent disease, use the health resources responsibly, and serve as the essential health resource. Next is responsibility to the profession. We say ensure that I am competent. We act with honesty and integrity. We demonstrate responsibility for self and other health professionals. We nurture, grow the profession. Next are the ethical principles. Ethical principles are the spirit behind a moral decision. In the course of practice of a pharmacist, technician, or assistant, certain challenging situations arise whereby a decision must be taken. In some situations, every decision will have its pros and cons. Some situations are actually gray areas that require a justification of one's decision. Ethical principles, they are the guide that directs the decision of the pharmacist, technicians, or assistants. They are the viewpoint from which the guidance can be obtained along a pathway of a decision. They give a backing to the reason why a particular decision was taken at a point in time. In the world of ethics, there may not be clear cut between right or wrong. Pursuing the ethical principles would justify our decision. Now, these are the ethical principles. A pharmacist, technician, or assistant is bound to certain ethical principles to follow as a part of his or her professional responsibilities. And these ethical principles include beneficence, non-maleficence, autonomy, justice, veracity, fidelity, and paternalism. Let's talk about these. First is beneficence. The principle guides the pharmacist or the assistants to do what is good always. The priority is to good makes an ethical perspective and possible solution to an ethical dilemma acceptable. Beneficence can justify giving a critically needed drug to a patient without a valid prescription. Non-maleficence, this principle seeks to do no harm or preventing harm. This involves any action taken by the professional to prevent the harm to the patient, even to the point of breaking the law. In such situation, the professional should choose to do the least harm possible and to do harm to the fewest number of people. A pharmacist who refuses to fill a prescription order because of his concern for patient safety is guided by the non-maleficence. Autonomy. This principle seems to allow the people to reign over themselves and to be able to make decisions that apply to their lives. This principle seeks to allow the patient to have the final decision, even if not in their best interest. If a cancer patient refuses to undergo surgery to remove the tumor and this decision is respected, then the patient's autonomy is respected. If doctor insists and performs the surgery to save the life of his patient, the doctor is acting based on beneficence, but he is violating the autonomy of the patient. Justice. The principle of justice seeks to grant equality with everyone. Pharmacists, technicians, pharmacy assistants, they provide the equal service to all of their patients. This principle seeks to be fair to all that is involved and never seeks to give preferential treatment. It is based on first come, first serve. Let's take a scenario of the justice. An asthma patient came to the pharmacy and is having an asthma attack and needs immediate relief with the Ventolin. Before him is a middle-aged sound woman who came to refill her monthly cholesterol medication. If the pharmacist goes ahead to attend to the woman, the pharmacist would be observing the principle of justice. If he goes along to help the asthma patient before the woman, the pharmacist would be focusing on beneficence but neglecting the principle of justice. Next is veracity. The principle of veracity seeks honesty without deception. It is the right of the patient to know the complete truth about his or her medical conditions and treatment. Pharmacists and other qualified professionals must tell the truth to the patient regarding his or her medical condition or treatment the patient is receiving. If a physician, for fear the patient might harm himself, refuses to disclose a serious medical condition to the patient, the physician has not observed the principle of veracity. Next is fidelity. So this principle seems to protect the best interest of the patient. Pharmacists, technicians, and assistants should provide the medical services to the patient, which is in their best interest. The principle of fidelity is followed while selling the cheapest but effective generic substitution to the patient or recommending the most suitable but the cheapest therapeutic alternatives. Paternalism. This is the violation of the patient's autonomy, probably in the interest of the patient. Any decision taken regarding patient's therapy contrary to the patient's agreement is paternalism. For example, when a physician uses his position and authority to manipulate the patient to choose the treatment that will benefit him or her, even when the patient refuses such medication, is paternalism, and it does not respect the patient's autonomy. This finishes with your first topic, law and ethics. Thank you.